Hi, I'm Fairly Mendoza. I'm one of the community health nurses at Saywalton Health, and this is my co-nurse, Connie Kirkham.
Hi everybody, it's Connie Kirkham. Nice to meet you.
I'm interested, Connie, in what you think about my personal concern is my sister. She's 65 years old, she has diabetes, and I think she has high blood pressure. She's living in a home with grandchildren, and I'm just worried about her. What do you think are some things that could help her keep safe from COVID-19 illness?
So that's a really good question, Fairly, and a lot of people are asking that. We do know that COVID-19 disease can infect everybody, doesn't matter the age group. But what we do know is that older adults and our elderly and those who have pre-existing medical health conditions such as heart disease, lung disease, diabetes, rheumatoid arthritis, people who have weakened immune systems because they're on high doses of certain type of medication, such as prednisone, or people receiving cancer treatment, and those who have had organ transplants, are at extremely high risk of severe complications if they do get COVID-19 disease.
So with that in mind, should she be going out to stores or having visitors in her house?
We really want to encourage our most vulnerable people in our community to try and have one person within the family household to do the main essential grocery shopping for that family member and drop it off at their home if they're able to do that. I understand in most cases sometimes it can't happen, and we just really encourage everyone, including those who are very vulnerable, to really exercise those protective measures that they've been hearing about all over the news to protect themselves from infection. And those public health measures, which a lot of you have heard a lot of, are maintaining that physical distance of 6 feet or more, washing your hands frequently when you touch high surface areas, light switches, door handles, faucets, remote controls, your phone, before you handle food and prep food, before you eat, after going to the washroom, all of those type of things. The other thing is to still cover cough and sneeze, into your elbow, or get a Kleenex tissue, sneeze into that, put it in the garbage, and wash your hands immediately after that. The other thing, don't touch your face at all, especially your eyes, your nose, and your mouth. Other things. There's so many other things, Fairly.
Yeah, well, I think those are the main things, and the kids are doing pretty good that they're washing their hands well when you're coming in from outside. And when those groceries come in, there's hand washing and washing down the cartons before they're put away. Those are some measures in the home. I don't know if they have much hand sanitizer left, but I keep telling everyone soap and water in 20 seconds is the gold standard, much better than hand sanitizer. I am concerned as well, Connie, though, that I think some of the kids are vaping. I don't know if they're smoking cigarettes or marijuana, but I've heard that the effects on lungs can cause greater risk with COVID-19.
And you're exactly right, Fairly. We do know that when we are smoking any type of substance, cigarettes, cannabis, and vaping products, it does irritate the lining of our lungs, and it can make us more susceptible to respiratory illnesses such as COVID-19. So we're really trying to encourage people, if they are smoking, there are health measures that they can get from their pharmacist or their doctor if they want to choose to reduce what they're using. The other thing is not to smoke any products within the home, and that way you're not exposing, other family members and your elders or those with pre-existing medical conditions to the smoke.
I guess lastly, I'm worried that if she gets sick, will she be able to get tested?
Right, that's a really good question. And as of last week, at the end of last week, there is broader community testing. If you are a First Nations individual living in a community, you are eligible to get tested. If you are worried that you have signs and symptoms of COVID-19 disease, and we know that most commonly it's a high fever of over 38 Celsius, or high fever in general, you have a cough, or if you have a chronic cough and it's been getting worse, or if you are having shortness of breath, call 811. It's open 24 hours, and you can talk to a nurse on the other line and they can refer you to get testing. Or if it's during the day and you can get a hold of your family doctor, we do encourage you to call your doctor and you can get testing, but do tell them that you are a First Nations individual and you are having signs and symptoms.
Thanks, Connie. I think just to remind everyone, it's well known that many of us, especially young people and children, can carry the virus for COVID-19 illness and have no symptoms and feel fine. So when I talk to the grandchildren, I keep reminding them that they may feel great and still have this virus and pass it to my sister, to their grandma. So we all need to work together to reduce the risk. Right, Sakura?
Yes,